Good afternoon, ladies and gentlemen. I'm Al Mattingly, the Daviess County Judge Executive, and this is our weekly COVID update. I always start it by wearing the mask to tell folks how important it is for you to mask up and reinforce the idea that we should all be socially distancing, that we should be washing or sanitizing our hands and avoiding large crowds. It's as important today as it was back in March of this past year. It's as important today as it was in the fall, and it's as important today as it was around the Christmas and New Year's holidays. We just have gone through that time period after Christmas and New Year's where we thought we would have large spikes in cases, and it proved to be so. The good news, I think, is it was not as bad as some of us expected it to be. My guest today is Patrick Bosley from Moonlite Restaurant. We'll get to Patrick here in a minute, but as always, I want to give you just a quick update. Today, Daviess County had 105 confirmed cases of COVID reported, and we had one resident in Daviess County that passed away as a result of COVID. So that brought our total deaths to 134. And if you would just join me for a moment of silence and remembering those folks who won't be with us the rest of this year. Thank you. So far this during this COVID season, our first case being recorded, I think, back in March, so a little less, about 11 months, we've had 7,957 confirmed cases in Daviess County. 6,000, the good news is 6,022 of those have recovered. We've had 134 deaths that have been related to COVID. The bad news is that means that we have 1,801 active cases out in the community. Now, these have been identified as COVID cases, so hopefully they are following the guidelines and are quarantining themselves. In my recent conversations with Clay Horton at the health department, if we've got 1,800 that we know about, we've probably got 4 or 5 times that many who are out in the community and have not been tested and don't know they have it, and they're spreading it. The other bad part of this news is that we have 30 people in the hospital again. So those folks who are hospitalized as a result of COVID, we're seeing an uptick again, and the number of folks that pass away is directly proportional, directly related to the number of people that we have in the hospital. So it's still out there, it's real, it's live, and we all need to make an effort at wearing masks. And in wearing masks, you know, it protects me some, but I'm actually showing the respect that I have for you, because when I wear a mask and when you wear a mask, the transmission rate is negligible. Now, somebody asked, and Patrick, if you'll just give me a second, somebody asked over the past week about double masking. I saw a program last night where the CDC is starting to recommend that you might want to double mask, particularly as the variant strain gets a foothold. You know, if one mask is good, 2 masks is going to be better. But you can go on the Kentucky COVID-19 at ky.gov. You can find all the information that you might want to hear. You can also go to the CDC and look. I was in a conversation with the governor today. The really good news, and Jordan, if you will bring up the map, I'll talk a little bit about it. This is going to be an incident map that you can find on Kentucky COVID-19.ky.gov. You're going to have to get it. There you go. A little bigger if you there. One more time. We'll see if we can't get it big enough for you to see it. All right, I can just about see it. The good news is, if you look at this map, you'll see a couple of things. Our overall current incident rate for the state of Kentucky is 60.27. Last couple, we were actually down in the 50s, but it's 60.27. The positivity testing rate has dropped below 10%. And you'll notice those gold looking, they're actually orange, they're supposed to be orange counties where the rates have actually dropped below 25 cases per 100,000 population. We haven't seen those on a map like this since back in December. Predominantly, so that's nine, I believe it's 9 counties, 6, 7, 9 counties out of 120, but it's a start and it's something to be happy with. You'll see where Daviess County has popped back up. We were down to about 80 cases per 100,000. Now we're back up to 92. Hancock County, if you look, is at 103 cases. Hancock County's got a very small population. And to give you an example, Hancock County reported 13 cases today. Well, in order to bring Hancock County on a par with Daviess County, where you have about 100,000 population and they have 9, you end up multiplying their number of cases by 11. So they had, where we had 105, they had on a per 100,000 rate, they had 144, 145. So it doesn't take a lot of cases in very small counties to go from 0 to going through the roof. I remember Robertson County up in the east had last week, they were in the green, meaning they had less than 1 case per 100,000. Well, they got about 2,000, 2,500 people. Today, they're at 47.4. So it doesn't take a lot, particularly in smaller counties, to change that. But I thought it'd be interesting for you to look at. You can find this map on the Kentucky COVID-19 at ky.org. You find it there every day. I go there every day to look at the update. This was as of 1/26/2021. One other thing, let me talk while you change it back and get us on the regular picture, Jordan. One of the other things was that just please remember that Monday numbers are often an anomaly. And by that, I mean, if you see just 40 cases like we had this past Monday, know that there's something probably wrong. And in this case, this past Monday, the hospital did not report out. And so all of that got rolled over into Tuesday. So you saw us jump from 40 cases Monday to 170 some odd cases Tuesday. So they always catch up, but sometimes they get the numbers are skewed depending on when they're reported. That's why you want to look at the 7-day rolling averages. They kind of smooth those kinds of things out. Mondays typically are very low, followed by a very high Tuesday. So don't get discouraged. Just know that when you see that we're probably going to have an uptick the next day or two. I want to remind you, I had somebody call the other day, I think it was yesterday, and they said, where can you get tested for COVID? Again, Daviess County Health Center test upcoming are testing on February the 3rd, the 10th, the 17th, and the 24th. So it's February the 3rd, which is a Wednesday, and I believe they test on Wednesdays, the 3rd, the 10th, the 17th, and the 24th. They typically test between 11 a.m. and 1:30. And if you'll call the Daviess County Health Department, they can schedule you a test. You have to make an appointment to go there. Flu shots can also be set up for those who are 65 years of age or older. In having a conversation with the governor, the good news is this. It's good news and bad news. The good news is that there is more demand than we have supply of the vaccine. And it's good because there are a lot of people who are saying, I won't take it. I'm not going to take it. The government is putting transmitters in my blood and they're doing all these other silly things. We've got a lot of people out there that would like to have the vaccine. So that's great news, knowing that we're going to have people taking the vaccine. Bad news is we don't have enough vaccine to handle them. But we did receive word from the federal government that they are going to increase the amount of vaccine that we get. Right now, I think we get about 56,000 doses every week. and they're going to increase that up to about 65,000 doses of vaccine on a per weekly basis. Here's the problem. We have 1,500 authorized providers of vaccine, 1,500. That averages out with what we've got right now to 35 vaccine doses per authorized provider. Not a lot. If you look at counties, it works out, and I forgot, I worked it out. Let me see if I've still got it. Yeah, it's about 450 doses per county per week. That's not a lot of vaccine. Now, part of the problem that we've got is that we have small counties like Robertson. You have large counties like Daviess or Warren or Jefferson or Fayette. Sometimes you get a lot of vaccine into one of those small counties, and once it's open, a certain percentage, they come in so many doses per vial, and when it's open, it's got to be used. They don't have the people to take advantage of it. So what they're doing is the governor has tasked Secretary of Transportation Jim Gray with setting up regional vaccination stations or centers, and these will be large centers. Most of them will be drive-through. They might have a couple multi-line walkthroughs. Don't know exactly. They haven't announced where they're going to be. Their goal was that no one would have to drive more than 45 minutes to get to one of these regional sites. Don't know how it's going to happen. Don't know if Daviess County will be one or Henderson County perhaps. Those would be the logical places because of their population centers. But we'll just have to wait and see, and we'll put that on Facebook as soon as we can. Really the best news that we could hear will hopefully come within the next week or two. Johnson & Johnson has a vaccine that they will be taking to the FDA asking for emergency approval to use that vaccine. And the reason it's good news is it's a one-shot vaccine. Right now we have really a logistical issue trying to get 2 doses into your arm of either the Pfizer or the Moderna. If we could just have to inject 1 dose with the Johnson, then that saves a whole lot of problem. We won't know if it's going to be granted that emergency use authorization for the next week or 2, but when it is, we'll let you know. So that's pretty much the update on what's going on. Hopefully, I'll try just quickly so I don't forget it. Next week, we're going to have the presidents of Brescia College, Brescia College, Wesleyan College, and Owensboro Community and Technical College. Those 3 presidents will be on here, and they're going to talk to us kind of about the same thing that Patrick's going to talk to us. How has COVID affected their delivery of secondary education, post-secondary education? And that ought to be exciting. The week after that, I'm going to try to get Dr. Dufresne back. So somewhere in the middle of February, we will be able to talk again to a medical expert. I may very well be able to get Clay Horton from the health department and Dr. Dufresne on here to answer any other questions you might have. Patrick, I don't want to take any more of your time. Remove that mask. I know you're sitting in your office by yourself, as I am. And let's get started. Good morning, or good afternoon. I'm sorry.
Yeah, good. Glad to be here.
Well, it's nice to have you here. I've known eating at Moonlite for a lot of years, know the Bosley family, and I was just, I don't know where I was or when I thought about it, but Patrick's popped up. Actually, Kenny popped up, and I think he said Patrick will do it. So he kind of sent it down the line. But we want to just talk about some of how have restaurants fared? How have restaurants dealt? Because restaurants have gone through a heck of a lot in our community and in our Commonwealth in an effort to prevent the spread of COVID. So, how's the pandemic impacted the Moonlite? Tell us about it.
It's brutal. I mean, just brutal. First off, I'd like to start out that I'm going to speak more about casual dining. We're restaurants we're all in the same storm, but we're not all in the same boat.
Right.
So there's a big difference how this pandemic is affecting fast food restaurants versus how it's affecting sit down dining restaurants. So I can only speak to what I deal with
Sure.
predominantly, which is casual dining. My overall sales across the board are down about 60%, counting catering and dining in both. We're able to roll out some changes. We now offer curbside that we didn't offer before. We implemented DoorDash for delivery service to bridge that gap of delivery. And, you make changes. My mantra has kind of been what I'm doing on Monday is not what I'm going to be doing on Tuesday. So we kind of evolve and learn from this. But Moonlite being a destination restaurant, an attraction for the community, makes us more susceptible because half our business is tourism. So 50% of the dine-in business is tourism, and that's just kind of been decimated. Even sports tourism, which is something that I think gets overlooked. We have 4 high schools here in Owensboro. Anytime they play an out-of-county team, that brings dollars into our community. So they're coming out of Breckenridge County, Muhlenberg County, Hopkins County. All these teams come in and play games in Owensboro. They come in here and they shop and they eat. And so those audiences being reduced to a bare minimum removes all that, what I call sports tourism. Not just talking about the big tournaments that we have in the summertime, which we may not have, the football and the soccer and the softball tournaments that bring a lot of economic dollars into the Daviess County community. And then we lost the romp, we lost the barbecue festival, yeah. and these are just big challenges to the community. These are new dollars that come in that did not come in or are not coming in. So that's a challenge. But for us, the other part of it is catering. A big part of Moonlight's business is catering, either, doing events, weddings, big events outside, which you cannot have right now, Christmas parties, Easter get-togethers, these times that big families would eat out. You're not able to do those. So it's a big economic challenge.
Okay. Well, Patrick, you make a good comment. As an example, when we lost Romp, not only did our restaurants suffer, but all the other places suffered as well. But restaurants suffered disproportionately, I think. While perhaps we lost Romp, you guys, the hotels lost some of the ability to sell the rooms, but they continue to sell the rooms. Restaurants on, was it 2 occasions, were totally shut down. You just couldn't do anything other than your curbside pickup and some of the things that you did. You changed your business plan, business model. But when they shut restaurants down, I mean, that was like driving a nail in a coffin.
Yeah, if we didn't get some federal assistance, I don't know if we would stay in business. We were able to draw, and lots of people helped us stay in business. Okay. Of course, the big chunk of it was a federal PPP loan, which right. some of that is a grant, and some of it's a low interest loan. But we did get some money. We did get early on. The help came in significant ways. Daviess County were able to provide us with masks early on. This personal protection equipment. We have 2 rounds of masks provided by Daviess County government when masks were hard to come by. So, and then we had other businesses like Four Roses Distillery provided us with hand sanitizer when we were having a hard time coming up with hand sanitizer. They provided that free to us. Companies like Pepsi made banners for us for free that we could put up to let people know that we had carry out open when the dining room was closed. So, your partners have really stepped up in the community. So it's a great community to belong to when people can step up and help you. But, a lot of this is a drop in the bucket. I'm grateful for any help that we can get. But sometimes I think the scale of the problem gets overlooked. The city of Owensboro provided us with $10,000 in a grant to offset our losses, but that really represents about 1/3 of a week of payroll. We're running 80 people on a payroll, so your payroll can hit anywhere from $30,000 to $40,000 if you're running full employment, and that's a significant challenge because your sales are not even high enough to pay all your people. So scheduling gets to be a challenge. We're looking at 50% of our employees doing some kind of partial unemployment where they're working, but they're not working the hours they were working before. And that gets overlooked. When you think about unemployment, you think about people who lost their job completely. But there's a whole class of people, our waitresses, hostesses, these people who are working on reduced hours. They still have a job, but they're getting a fraction of they're getting a significantly less than they were before.
Right.
And waitresses really hit hard.
They have been hit hard, and when you mention unemployment, just as an anecdotal, we here at Fiscal Court have helped hundreds of people with their claims with an antiquated unemployment system. And as I've said before, I don't blame anybody for the pandemic. I don't blame anybody for a system that was designed to handle 500 claims a week, and all of a sudden they got 50,000 or 100,000 claims a week. But a lot of those folks, I still am getting calls from people who have not gotten one penny since March because they fell through a crack, or there's no live person that can give them any help. You know, it's interesting, and you're right. Lots of folks, lots of businesses, small businesses, were helped with PPP loans. I have a private business, and thank God we got that. Of course, also, I suspect that the Bosleys have put some money out of their own pocket back in the restaurant to make sure that the lights stay on and the doors stay open. And I know you guys are just like me at my private business or here at Fiscal Court. My number one concern is my employees. Without my employees, I don't have a business. Without the employees here at Fiscal Court, we can't provide you guys with the things that we have. How have you been able to I was in the restaurant the other day just to have coffee and saw some of the ladies that I have seen in the past there. How have you been able to maintain that list of good employees? What have you had to do?
Well, first of all, you have to operate at a deficit. We're losing money every week that we're open, and it's a commitment to being in business for next year. It's a commitment to taking care of your health. You know, I'm running help sometimes I don't want to say I don't need, but I don't have the business to pay for them. And you're trying to keep them employed. You're trying to keep them with your company so they don't go work for another company. You know, we have a lot of employees that have that conversation that they need to look for something that's more reliable, and they'll switch industries. It's a challenge. We just do the best we can. You dip into your own reserves, you dip into your own pockets, you dip into any program that you can find that helps, and you kind of keep your eye on the prize, which is hopefully we'll turn the corner about Easter. You know, hopefully come April or summertime, we'll see some consumer confidence rise as the vaccine gets distributed better. But until we see the ability to work at more than 50% capacity, until you see the ability to have a group of people be able to come in and dine, you know, large families again, weddings, funerals, restaurant industry is going to be significantly challenged. You know, it's going to be it's just brutal. And I don't know how long some businesses can hang on, because they're just hanging on hoping to turn the corner. And there's going to come a point where it's like a domino effect where these certain businesses will start failing.
We, you know, you mentioned the city and their program. The county had a program for those who were outside the corporate limits of the city and paid county occupational tax. Wasn't a lot of money. I think we distributed $5,000, and they could use that for anything they wanted. And it was amazing to me. There was a very small mom and pop restaurant who said, "Thank you. This will help me when I have to reopen my doors." Lots of people don't understand the cost that's associated with shutting an operation down and then bringing the operation back to not even full capacity to half capacity. And you're, you know, in your business, and you mentioned the city, PPP was there. There are some programs out there, some of them not worth dealing with because it doesn't bring a lot, like you said, it doesn't bring a lot of money in. But there are some people out there who have said that, hey, government hasn't done enough. Not one government official has been into a restaurant and talked to them about their needs. And I guess my answer to that person is, we're here. I answer my phone every day. And I know as far as Daviess County is concerned, the program we identified 30, 32, 33 businesses that were eligible, all mom and pop. And when if they didn't apply, we called them and said, "Hey, what's going on? Are you aware that there is money here?" The state had a program out there. I'm not real familiar with how the state had it set up. I know the city had a program, pretty simple to apply, pretty simple to get. Can you explain, did you participate in the state program?
Well, the state program, we got $10,000 from the state of Kentucky, and it's much like the federal program. You fill out a bunch of forms and you make phone calls and you try to dot your I's and cross your T's. The city program, there's a program in the city that hasn't rolled out yet. So we do think there's some help coming from the city, They have allocated some money that's going to go to different restaurants and based on the number of employees at the restaurants. We haven't seen that yet, but it's supposed to be happening. I think I may have misstated earlier that the assistance that came from the city, it actually came from the state. The $10,000 came from the state. The city has a program that's coming. And
I talked to the mayor or maybe the city manager, and they were talking about they were rolling that program out. They had applications were coming in, and now they were vetting the applications and going from there. I know that the city and the county both put about $300,000 into a fund that was distributed by the United Way to help people out, and it was there for rent assistance, utility assistance. It was helping not-for-profits who might. You're right. The city and county put some money in, and then the local community added another 400,000 or 500,000. We have a very, in my opinion, a very giving and caring community, and lots of times they just don't know how to help. They want to help, they just don't know how to help. What would you say to somebody that's watching the program today? And I think I know the answer, but what's the best way to help restaurants who are struggling right now?
I think that if you don't feel comfortable eating out, one of the big things you can do is buy gift certificates from local businesses. This puts money in their pocket now and potential business in them for them in the future. So a real good thing to do is buy gift certificates from local businesses. That creates both business and revenue. One of the other things to do is choose where you want to spend your dollars and the businesses that you want to see in business. It's really easy to shop online. I hate to get outside the restaurant industry, but it's real easy to shop online and have something shipped to your house and forget that you can buy those same things at a local store, even if you have to have it picked up curbside. Because when you shop, even at a big box store that's in your community, you're supporting those local jobs. So this is definitely time to circle the wagons as a community and try to figure out how to shop local, even if it's at a big box store, because they're employing local people. But for restaurants in particular, there's three things I think you can do. You can dine out, you can eat local, you can buy gift certificates, and for restaurants like Moonlite, who has a catering service, you can suggest your employers cater a meal out. Moonlite has the ability to do, even 100, 300 plate lunches, box lunches that can go out to businesses. And we've seen that model shift in our catering, where we used to show up with bulk food. You went through a buffet line at your factory. Now we're doing box lunches going to the factory and plate lunches going to the factory. So, the three things you can do is, try to get your business to host a lunch for your employees with individual plate lunch that you can provide, or individual box lunches. Moonlite, Mike Clark in our catering department here at Moonlite has the capability of feeding any size business in the Owensboro community, a lunch or a dinner, within the current health department guidelines.
Well, Patrick, I think what you said, shop locally, that's something that we all talk about. Shop locally is something promoted by the Chamber of Commerce. Anymore, it seems like it's all year round now, because it's so important, and we keep those dollars here as opposed to sending them outside of the community. When you keep them here, then we can circulate them. They go to buy gas, they go to pay for the plumbing, they go to buy clothing for the kids. So do you have any, I'm assuming, are you a member of a restaurant association?
Yeah, I'm a member of the Kentucky Restaurant Association, and they do reach out to us, I guess, as a kind of a large Kentucky or recognized Kentucky restaurant. I've been reached out numerous times for our opinion on lobbying for the Kentucky Restaurant Association. I think across the United States, the National Restaurant Association had a number of like 110,000 restaurants have already closed in the United States. Some of those are permanent closures, and some of those are hoping to reopen. But even in Owensboro, you've already seen restaurants close down for short term and long term. And I don't think that's over yet. I think it's not. I think we will see more restaurants close in the Owensboro, Daviess County community before the pandemic is over.
Have they given any indication, and the governor has not, I don't think we're going to see it again, but you went through two complete and total shutdowns. Have you been given any indication that might be again in the future? Of course, we don't know. We can't see. We're not clairvoyant, but
my crystal ball is pretty fuzzy these days.
Yeah.
I know another, I don't know how many restaurants will survive another complete shutdown. Most of them are struggling to survive at 50% occupancy. You know, restaurants operate on a razor thin profit margin that really depends
Yes.
on volume. So at 50% occupancy, the smaller restaurants can't even survive on 50% occupancy. They just can't generate enough revenue to pay all their bills. You know, Moonlight at 50% occupancy, I have a hard time filling up 50% because we're so big. Pre-COVID, we seated 350 people at Moonlight. That's back to where I say we're all in different boats in the same storm. There's a lot of times I'm not operating every dining room at Moonlight while we're at 50% occupancy. And part of that is we don't see the tourism that we're used to having that fills up the rest of our seats. Moonlight's twice as big as a lot of restaurants in Owensboro because we fill up with tourism. Without that tourism, you're not operating with a huge overhead without the revenue to support it, you know. So it's definitely a challenge.
Yeah. That everyday cost continues to go whether you're feeding one person or 300 people. So it's a lot of people don't understand that. Also, one of the issues that you have in a smaller mom and pop 1, 2, 3 person restaurant where mama, daddy, and a couple of the kids are working in the restaurant. That's the employees. They don't have the money to go for very long if they don't have any revenue coming in. They just don't have. As you said, there's not that much profit to be made on a per dollar basis for a restaurant, and even places like Moonlight. I mean, there's not, the money tree is getting pretty bare, isn't it?
Yeah. We're dependent now on money that we're borrowing. I mean, like we burned through our cash reserves, the ability to put money in the business. You know, now you're at the point where, you know, I joke sometimes. Somebody says, "Hey, are y'all going to make it?" So as long as the banks want to keep loaning me money, we're going to keep being in business. But you know, this can't go on indefinitely. There has to be an end to keep restaurants as you know them alive. There has to come an end to this kind of crisis. One of the big challenges on a shutdown is you get no notice. So it's a little difficult on our end on communication that I literally have to tune into the governor's Facebook live feed to find out whether I'm going to be in business is a bit of a challenge. And they literally tell you on one day you're going to be closed down 1 to 2 days later, and you've already purchased a week's worth of stuff. You know, a company the size of Moonlight may have $30,000-$40,000 worth of food in the refrigerators that you're planning on selling, and then they tell you have to close. And you know, we face those challenges twice, and both times we face those challenges by reaching out to the community and doing food giveaways. You can give it away or throw it away. So, you know, Moonlight paired with several businesses in the community to do food giveaways, but that money's not free. That food's not free. It's another hit to your bottom line. And we want to support the community.
That's funny that you should mention it because the second shutdown, I think it occurred on a Wednesday. You were given notice on Wednesday, shut down on Thursday. And I'm not bashing the governor, but I wish that he would have some local people that he would listen to their advice, because as a local elected official, I'd said, why don't you shut it down Sunday night, allowing people to go through the foods that they had purchased for the weekend, as opposed to shutting it down in the middle of the week and them being stuck with all the food. But, you know, thank God I'm dealing with 100,000 people and the governor's dealing with 4.5 million people. And I'm dealing with 400 square miles, and I don't know what the square mileage of the Commonwealth is, but so I'm not here to bash anybody over that. Patrick, I want to thank you for coming on. I thought it was important that people hear from the mouth of a small business owner, particularly a restaurant owner, and certainly Moonlight fits all those bills. And let's just hope that things get back to as near normal as they can here before the summer comes, and you guys can continue that long family tradition of serving some of the best barbecue in Western Kentucky, if not the United States.
Yeah, and like I say, we do have our buffet back open again. That was a challenge to work with the health department to get that worked out. And you do things like that by having servers. So now there's buffet servers. So you take some employees who were going to have their hours cut in one location and you reallocate them to another spot. So being able to do them in the restaurant, having that buffet open has been a big part of us getting our revenues back up by being able to go through the buffet line, have an employee build you a plate just the way you want it. That's kind of been a key to us kind of making it.
Okay. Well, Patrick, say hi to everybody there at Moonlight, and look forward to the day that I can come in and go through that buffet line in person.
You can get that buffet line in person. You can come on down tonight for dinner.
I
Just get
hear-
me there
I
before it
hear-
snows, I guess.
Hey,
No.
I'll tell Judy. We'll see what she wants to do. All right. Thanks, Patrick.
Thank
See
you.
you. Thank you, everybody. We'll see you next week.